Good morning, dear students. So far, we have touched upon many topics in our clinical medicine, which I hope would be interesting to you, especially backbenchers like me. In my MBBS days, I used to be a favorite student of back rows, either daydreaming or looking outside. I'm not finding out fault with our teachers, but the thing is that everyone is different. So, introduce myself. I am Dr. G.V. Chanukya, an endocrinologist. I did MBBS from SV Medical College, Tirupati, Andhra Pradesh. It is a government college. And thereafter, I did MD. And after MD, I got a little bit, you can say, mid-career crisis. Either I should continue at the general level or should I go ahead with the specialty. In those days, endocrinology seats were very few, hardly 4 or 5 throughout the country, unlike the present. So either we had to appear for national institutes or state level. In those days, in Andhra Pradesh, there were 2 seats, but both were reserved region-wise. Though I could get first rank in the state level, unfortunately or fortunately thereafter, I didn't join because in my place, a 3rd ranker and a 5th ranker, they have joined. So you can say, taught me a hard lesson. Go for higher studies and prepare well and aim for national institutes. Fortunately, with the help of family members and friends, I was get through PGIMER Chandigarh. Of course, there was only one seat. Either I had to get first rank or nothing else. So it is all like all or none phenomenon in our neurology. Even if we get second rank, we won't get seat. So those 3 years taught me that person from a rural background who was sitting in back rows and just passing exams, hardly scraping through, you can say 50%, can make to this level. Any student, I am telling the truth. So anyone with, you can say, minimum knowledge but interest, if they got in any subject, if they get a good teacher and good grasp of basics, means just like constructing a building. See, without constructing base, we can't go on putting these floors. For example, if we are constructing a building, without a basement, we can't go on constructing. Only with good foundation, means good quality of materials, just like we are constructing a structure. So those basics which are universally applicable, means uniformly applicable across the specialties. It can be ophthalmology, ENT, medicine, surgery, including CTVS, transplantation, biology, cancers, like say oncology, neurology, endocrinology. Everywhere basics remain the same. Because, for example, previously also we had discussed in section of fever, kind of those things, all those cytokines, they might be pyroxogenic, means they might be causing fever. On the other hand, they can be having anti-tumor activities also, or they can be pro-inflammatory, sometimes carcinogenic also, and can be catabolic. So across various specialties, for example, you have come across treatments for retinopathy in the setting of diabetes. So coming back to reality, in our settings, either as a student we should have interest in our subject, or there should be a teacher who is interested in improving our knowledge. But as we are witnessing nowadays, actually there is depth of good teachers who can cultivate interest in the students, especially in medical field. With the mushrooming of medical colleges in every nook and corner of any city, you can find very few interested in teaching students. Most of times what I get feedback from those studying MBBS, especially in private medical colleges, their professors used to, you can say, they are discouraging students. What is the value of MBBS? Nothing it is there. Further you have to do MD, DM or kind of those things. But this is a very wrong advice. Without basics in MBBS, without seeing patients, even if you get MD or whatever specialty, you are going to be always incomplete. Means, as I have told, without a good basement, a infrastructure won't come up, either it is small or big. So I always advise my students, either you can learn from a teacher, or if teacher is not available, you can be self-taught, especially with the advent of internet and artificial intelligence. So first thing is that you should have interest in improving yourself. So in this scenario, aim of our classes is at least to cultivate some interest, because I am not aiming for didactic teaching. Didactic means this is only for those who are sitting in front rows, always glued to screens and always hyper competitive, want to get first ranks at the cost of others, jealous, kind of those things. Because learning is always two-way process. Those who are not teaching others, those who are not mingling with others, those who want to limit their subject to themselves, they are not going to prosper in their life. They never grow up. They may reach some heights, but they won't be successful as they should be. So whenever you are discussing with your friends, or when you are learning from the internet or AI, please share that knowledge with your like-minded people, just like you. If they are interested, well and good. If they say this is nonsense, try to find out someone else so that you can discuss. Because in this way, I have been self-taught and learnt few things, though I could find very good professors at National Institute.